Good morning, everyone, and welcome back to Global Health Uncensored podcast. Today, we are joined by a woman whose career has moved from the clinics of Nigeria to the boardrooms of global power. She's a Harvard trained health economist and a former World Bank senior specialist. She's now working as a global director of impact measurement at Visa. She's led health reforms across continents, from Moldova's COVID-19 response to systemic overhauls in Sri Lanka and Sierra Leone. But her real mission is rewriting how development institutions think about women, data, and power. So, without wasting much time, I'd like to welcome our special guest to the Global Health Uncensored.
Thank you, Dr.
So,
Banda. It's very nice. It's very nice to join you in this conversation, and I look forward to sort of exploring my journey and you know, sort of how it's moved from clinical medicine to global health to social impact and the adventure that it's been.
yeah, I mean, if anytime I read through um, stories or journeys like that, it's really fascinating because I know a lot of people. If you're in Africa and you do medicine, all you know is clinic. All you know is patient contact. But once you move beyond that point, you get to see how your impact can span across multiple sectors. So I want us to start from the beginning. I know you trained as a medical doctor in Nigeria. Um, how did your early clinical experience shape your understanding of health? Um, so if you can walk us through that journey, that would be really great.
Yeah, so we have to go way back to sort of understand how I got on this journey. It starts with a significant health event in my family. When I was 7 years old, my father died of brain cancer, glioblastoma. It's almost 100% mortality. And I remember that event just shaking my family, to the core. And for me, just bringing home how important health was, life or death. And so when I was maybe 12 or 13, I decided to become a doctor. And my full intention at the time was to become a neurosurgeon. I had read Gifted Hands, written by Ben Carson. I fell in love with his character as a
Mm-hmm.
person and his career and the connection to my father's brain cancer. So it seemed intuitive. I was going to become a medical doctor. I would do well in surgery. I'd become a neurosurgeon. And everything sort of went that way. Medical school went really well for me. I was at the top of my class, really great at surgery. And then the penultimate year of medical school, I was headed from the classroom to the ward rounds, which were in a different location, and sleeping in the back of my friend's car when we had a very bad accident, an accident that resulted in injury to my spine.
Oh.
And so I went from, being about to graduate, top of the world, headed to, maybe a surgery residency, to being strapped down to a bed, traction, weights, people trying to figure out how they can make sure my spine doesn't get, injured, trying to deal with some loss in sensation, loss in movement, things like that.
Mm-hmm.
Over a couple of weeks, physiotherapy. And then I still remember the day they came into the room with a hospital bill. And my mom couldn't pay. I had no insurance. Anyone that knows Nigeria knows, federal civil servants, some state civil servants have health insurance. Everybody else basically pays out of pockets. It always had been like that, but the cost had been manageable. An injection here, an injection there, medicine here, medicine there. Never the hospital bill for a private room over 6 weeks plus physiotherapy. So my mom sold her car. It still wasn't enough. I was detained in the hospital. And then my dean, you know, heard about his students being trapped in the hospital and came and signed a guarantee that to let me go and to give me the opportunity to pay when I started earning as a physician. That experience rocked me to my core. So that was the second juncture. It was a so you can have the best doctors in the world. I was in one of the best teaching hospitals in the East.
Mm-hmm.
And if I weren't a medical student with a dean to sign a guarantee for me, maybe wouldn't have had access to care at all.
Yeah.
So he started my thinking around health financing. It turns out that there was this really interesting group called the Health Policy Research Group that had started in UNTH, University of Nigeria Teaching Hospital, led
Okay.
by, we call him fondly Prof, and had people like Chimon Oka there. These people are still players right now in the
Yeah.
scene, Obinon Jeffrey. And, I remember having conversations with them and drawing parallels between the thing I was experiencing, the things they were solving for. They were looking at health
Hmm.
insurance, they're looking at health financing. Where do we get money? How is that money spent?
Yeah.
So that was the how my thinking about health shifted from let's focus on the human body and its different systems and how they break down and solving that as a doctor, to let's think about the broader sort of factors that shape who gets healthcare or not.
Yeah.
Service delivery, health financing. It's that journey that sort of led to the series of choices that have landed me here, right? The next step for me was, well, two steps away was Oxford for my master's, and then Harvard for my PhD, and then the World Bank to finally,
Yeah.
after 7 years, start doing the work. But yes, that's the quick synopsis.
Yeah. So, okay, so I would say like the defining moment for you was that experience of um getting involved in that unfortunate accident and then witnessing how financial decisions affect health and all that.
That's exactly right. And I would say it's interesting how, so in Nigeria we had a civil war in the 60s, and one of the things that came out of that civil war was to promote integration in the country. When you grow up in the south, you go to the north and you spend 1 year post graduation working. If you grew up in the north, vice versa, you come down to the south. It's called the National Youth Service Corps. So, I had my personal experience with that accident and experiencing disadvantage in terms of access to healthcare. But the 1 year I spent in Yobe State in the north, having graduated, it just really brought it home for me. I sat in the state specialist clinic. It was the referral clinic. So, in the villages surrounding, they would have little primary care centers with a nurse. Sometimes this was not a registered nurse. So it's really somebody with some basic healthcare training. We would call them community health extension workers. And so when there was any problem that was above, a small fever, a small headache, these mothers would walk sometimes hours to come and see me with their children sitting in the pediatric clinic. One incident I will never forget, a woman who came with her son. I diagnosed very quickly this was meningitis. Now, meningitis is deadly. This child was convulsing, had high fever, and all the classic symptoms. And I wanted to admit urgently and start treating.
Hmm.
And this mother told me that she needed to go home to discuss with his father, who was a cattle herder and had, if she could retain the son, should, and just for me, it was, I've gone from my lens of the body is important to, yes, let's think about the body, but all these factors shaping whether this body can get into a clinic and interact with the physician,
Yeah.
to, even beyond health systems. This mother doesn't have autonomy. She doesn't have resources. She walked all the way here. So there's culture, there's gender, there is income, and so just and in medicine, in healthcare, we call this the social determinants of health. So it's interesting how even before I took my first class in Oxford on the social determinants of health, I understood viscerally as an individual, and
Yeah.
through my work and the people I had served, that you cannot solve the kinds of problems that consume most of us every day by fixating on the physician, on clinical service delivery, right? So I agree. I think my personal experience was pivotal, but I think what made this a mission for me was also seeing how, for a lot, this was the case for millions of people in my country, and now I've discovered billions of people around the world are being excluded from care for like broader factors beyond like if clinical, and the body breaking down.
Yeah. That's true. The- I know you briefly mentioned your journey to graduate school post medical training. I want us to briefly explore that route. I know a
Mhm.
lot of our followers are also, some of them are physicians looking at ways to explore opportunities outside of the clinical practice. How was that entire journey like? Applying to graduate school in two different countries. How was that journey like?
Yeah, I mean, I think for me, each time it started with like a why, right? So I talked about my story and my experience, with mothers in the north and my personal experience. And so I sort of narrowed down to I really want to be part of like figuring out access to healthcare. And then that was sort of for me the grounding for thinking about, what do I need to get there. So I had a couple of conversations, I think, exchanges over emails with some experts in the field. And he said, there are a couple of graduate programs that we think will give you the knowledge and the skills to excel here. And because this is a very crowded space, going to a very strong program, a well reputed program, is probably a good thing, a place where you can get practical experience. So, looking for programs where you're not just sitting in the classroom, you're also being exposed to working in the field is something to consider. Looking at programs that don't only select for physicians, so that you're not in a bubble of sorts with people who only see the health problems one way, was also something to consider. So I had this criteria, and I had one really important one. I'm from a low income family, so there had to be a scholarship. So I remember I remember at the time shortlisting a couple of programs. I had three: the Oxford program, the very well reputed London School Health Policy Planning and Financing one, and University of Edinburgh. And I was admitted to all three. I chose them because they checked all the other boxes, and I selected the Oxford program because it came with a scholarship from ExxonMobil, right? And that one year was pivotal for me because I really began to understand the concept of health systems. What are the blocks that sort of
Hmm.
fits together? I learned the different frameworks. I learned to ask the right questions, to think about how to answer them. And then I met, importantly, Professor Rifat Atun. At the time, he was a professor at Imperial College in Health Systems. And I talked to him about how I felt like I was beginning to grasp the issues, but I didn't feel confident enough to start solving for the things that I saw in Nigeria, right? It's like,
Yeah.
if you made me today a commissioner of health, I couldn't do that job. And he told me, I agree, you should do a PhD, like you are doing now, Dr. Banda, that big commitment. But at the time, when he sold me on the idea of just hunkering down over 3-4 years and focusing on this access to healthcare problem, perhaps studying the Nigerian context, right? So he sold
Hmm.
me on that as an endeavor and told me, the programs in Hopkins and Harvard are some of the best in the world. So that's and that's what I did. I applied to both. And it's interesting, at the time I applied for my PhD, I had not written one research paper,
Yeah.
right? So I had not written one research paper. I'd only gone to medical school and did my master's at Oxford. And so I remember looking at the criteria for admission. Right? They had you have to have done courses in microeconomics, multivariable calculus, linear algebra, maybe a bit of a publication record is good. They talked about your GRE scores. I didn't check half of those boxes, so I took a gap year.
Okay.
I took a gap year. I took my GRE. Thankfully, I made a distinction in my Oxford degree, which I felt was like a good signal of quality. And then
Yeah.
I joined this very small consultancy in South Africa called Consultancy Africa Intelligence at the time. It's now called In on Africa. And I started, a whole series for them on health systems. I started sort of researching the topics I cared about and writing about them. I couldn't get a peer-reviewed paper out in time, but at least I could demonstrate that I had the skills to produce that kind of, product that was high quality. And the third thing I did is I took some classes in a small university in New Jersey called Newark University in mathematics, some of the prerequisites. I think, and I've taken some of that feedback to other people that come to me, is that you don't have to check every box. Sometimes when people write, whether it's a position, this will come up in when I talk about the jobs I've done, or a school you're applying to. People are trying to look for a certain kind of person, and they have to put down ways for finding that person. The way to think about those criteria as proxies for the real thing. No one is recruiting for a GRE score or 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 a research paper
Yeah.
or a distinction. They're trying to find a student that can thrive in a PhD program, that can assimilate the information, that can
Mhm.
produce good research products, ask great questions. And for schools like Harvard, they're trying to find someone who might be a star in the future, right? So because there's a give and take. Is that they make you a star, you make them a star. I mean, I feel
Yeah.
like it's and so I sort of looked at the what we're looking for and thought to myself, okay, so even if I don't have what they want, what is the thing they're actually solving for? And how can I sort of, and so I encourage many people come from backgrounds like mine. We don't have the privileges that other people had to go spend summers in Kenya working with people doing medical school. A lot of my classmates did that. I couldn't. To do research with professors while you're in undergrad. I didn't even know that was something to do, right? But
Yeah.
what you can, there are ways, you sit down, with someone who's been in the program and you try and understand what are the professors looking for? What options do I have to meet that or demonstrate I have the competencies, right? So I don't know if that helps someone who might be, watching this and saying, oh, I don't have an Oxford degree. I'm saying it's not an obstacle. I don't have research papers. It's not an obstacle to get into a
Yeah,
strong program. There are ways to get around those questions.
that's true. That's true. And I mean, it's. I always say that one of the most important parts is telling a story that really
Right,
moves people. You
right,
can have all the publications,
right,
you'll still not get in. So that
right.
is very true. So you went to Oxford for your masters, and then Harvard
Yes,
for your
mm,
doctoral degree, and
yes.
then afterwards, what happened? What was next?
So it so happened that during my time at Harvard, we had this evening where we had a circle of Nigerians. I can't remember what the pretext was, but we had a Nigerian, who I really respect. His name is Kelechi Oyeri. At the time he had gone back home to support the Minister of State for Health, in new health programs, and he had done the masters at Harvard. And he was talking to us about this program in the World Bank called the Young Professionals Program, and how it was this remarkable opportunity as a young person to very quickly start, solving for the kinds of problems that started me on this journey in the first place. He talked about, as a health specialist, how he was leading, research products, sort of trying to define what are the solutions, options available to countries. He was leading teams to sit across policymakers and sort of, define what are the challenges, barriers to access to healthcare. How can the World Bank's resources, our money, our technical skills, our convening power support you? And I was just enthralled. I'm someone who is, it's true, I'm a thinker, I've done a PhD, but I'm also a doer. And
Mm-hmm.
the quickest path to, getting stuff done and results was something that I found attractive. So I applied to the Young Professionals Program. One of the most difficult, admission processes I think I've ever experienced. I think we had to wait 1 year, shortlisting. I think they said 10,000 people applied, and like 2,000 people were asked for references. And then we had 200 people in this 8-hour interview that involved a panel, and assessing your, how do you think through health problems, and how do you think about problems across sectors, and then, how do you interact in teams. So it was an exhausting process and just so exciting. And then I got into the World Bank, and that was just the start of an 8 years of just impactful work, right? From the very beginning. I remember the first country I led work in, and where I stayed the longest, was Armenia. And just to be able to, over time, build trusted relationships with the Minister of Health at the time, who is still a close friend, to begin to together sort of craft what does it look like to completely reshape healthcare in that country,
Mm-hmm.
um, you know, to design with him and the subsequent Minister of Health. These are the different reforms we need: primary health care, the processes, the structure, health financing, a new health fund, new sources of revenue, perhaps a new tax, purchasing to set up institutions, ways to pay providers, a new benefits package. So all those things that, if there was someone like me, that the situation I was in that hospital on that bed, to prevent that from happening to someone else, to put them in a clinic where a doctor was competent and capable, to give them access to a benefit package that covered the services that they need. They didn't have to pay out of pocket or sell a car. I really feel like, getting to Armenia and being able to champion that work and leverage the bank's resources brought for me that full circle, and to replicate that in other countries, Romania, Bosnia, some of the other ones that you mentioned, to be involved in those teams, right? And so
Mm-hmm.
that's what my journey in the World Bank was. It really was being able to pull the bank's resources to support leadership in those countries, to then solve
Yeah.
for the kinds of problems that, were constraints for me when I was a patient in Nigeria. Right? So
Yeah, I mean, this does sound like a really exciting and impactful work and journey. I would like us to talk more about leading in the front lines, especially as a woman. So y- your journey has been very fascinating so far, from the clinic to working in the World Bank for several years, and now working in Visa. So you've actually operated in multilateral power centers, corporate boardrooms. What's one leadership lesson that you had to learn say the hard way as a woman in this high stake environment?
It's the hard way indeed. I mean, it's interesting. I heard this story about how, when they would ask little children to close their eyes and picture the CEO of a company, many of them would draw someone that looks very different from me, probably a man, and of a different race. It so happens that across my career, I've most often worked in environments where people do not expect me to be leading, whether it's about my age or my gender or my race or my accent. You know, one story I like to tell is, years and years of building relationships and solving problems with a client. We started what is called a twinning partnership with another country, where we have multi-year exchanges designed to sort of build capacity in the receiving country that this, other country has sort of built out in their different health institutions. And so, having planned this engagement, we came for the launch event and we entered this room, and they seat the head of the government delegation that I accompanied at the center, and then my seat was somewhere at the far end. And I'm, initially I'm fine with this, and then it was time for remarks from the head of delegation, and my counterpart speaks, and then they turn to another member of my team who is an older man, and ask him to speak. And in that moment, my counterpart stopped them and said, no, Dr. Chukuma is the head of the delegation. And, in terms of lessons for me, I've learned over time to be myself. I think that there is something unique that you bring as yourself to the conversation in leadership on the complex problems you're trying to solve. Global health, while there are broad sort of principles about what works, like in health financing, we say you have to raise from compulsory revenue sources, things like that. What works in one country will be very different from what works in another country. And your
Yeah.
understanding of the culture, the practices, the interconnected factors will be critical for that specific context. And so I've learned this is who I am. I am this person who is forceful, who is African, who is a woman, who has grown up in the situation she's been, who's had these experiences. And it's precisely because of that that I am effective. And I've learned over time to assert myself. But there are times when I've learned you need allies. You see those trusted relationships you build with people who have power, really important. They're
Yeah.
sponsorship relationships that move you up the ladder. There are relationships that in moments like that where I was, usually I would assert myself, but I was completely caught off guard. And it was an ally that stepped up for me in that moment. And so I've learned also to be allies to others. I've been in situations where I'm the one who is, disproportionately powerful. And I'm the one who's leading the conversation. I'm the one who's sitting at the head of the table. I'm the one who has the loudest voice. And I've learned in those moments to think about who's not able to speak up, who's being silenced, whose ideas are being co opted, who doesn't have a seat at the table. How can I make room for them? Right? And so I suppose I've given you two for the price of one. Or that that I know it sounds cliche, but I think our authenticity is the reason why we are effective if we
Yeah.
match that authenticity with the right problems. But that allies are really critical. And it's important to build those bridges, right? Not just with people who are like us, but people who are not like us. That's where
Yeah.
sponsorship comes, and that's where support comes from. It's relationships are the things that drive change in the end. I found
That's true.
in my
Yeah.
work. Yes.
That's true. So you've walked through institutions. What would you say institutions can do to truly support the leadership journey of, say, women in global health?
Yeah, it's something I've thought about a lot, right? Because I'm a woman and I worked in global health. So, and I joined what I think is a call out to the Women Lift Health Fellowship, which is focused on tackling this challenge, right?
Hmm.
I think a couple of things that stand out to me, instead of aiming to be comprehensive, I focus on a couple of things that I think are really important. The first is, objective criteria. I remember trying to navigate one promotion in one institution I was in, and it was so difficult. You know, um, People who I felt objectively did not have a lot of the qualifications I'd done or the track record that I had were getting promoted, and I wasn't. I was passed over a couple of times. And so I remember very concernedly joining a conversation with my manager at the time, who I deeply respect. And we both came to the conclusion that this, because promotion was a black box, it was then about, do I sense or do I feel that this person is ready to get promoted? And in times like that, when you have the people in power, not being people who are female or women, or of a certain race, sometimes we only see those qualities in people who look like us. So
Mhm.
the first recommendation is make the criteria explicit. That's precisely what my manager and I did. We pushed for, can you list the things that a person needs to have to become the next level? Sure enough, in about 2 months, I was promoted. And sure enough, in that time, a lot of other people's promotions were subjected to a bit more scrutiny.
Yeah.
Right? So that's the first thing. I think because bias in some cases is unconscious,
Yeah. Yeah.
checklists and criteria are important, because it means we do need to engage with the hard behavioral change and shifting mindsets over the long term. But to make sure that the person who is disadvantaged inherently by this unconscious bias is taken care of, you make it explicit and you need to check off this list, right? The second thing I will mention is sponsorship. I think too often we have given women, oh, go to this mentor, that mentor, lots of advice. I found that far more important than that is somebody who has power that is speaking for you in meetings. For me, it was my manager, it was my director. And I've been in formal sponsorship programs where
Hmm.
someone very senior says, I am here to sort of support your career growth. It's something you can actively cultivate. By high performance, you make it less risky for this person to back you up. But also, I think it's something institutions can also formally institute. They can say, we're trying to cultivate, you know, talent. And so people who are top talent, who can we sort of attach them to sort of help groom them, and move up the ranks. So that's another thing that, I would also point at. Those two things. One, make it explicit so that, whoever is in that talent pool, it's not just one group that our guts say are the right people. And then the second bit, connect women to sponsors. Not just mentors and advisors and coaches.
And not the
Yes.
kind of sponsors we think about when people talk about sponsors in Ghana and in
No, not those kind of sponsors. A sponsor is no, we're not talking about somebody who give you money. We're talking about somebody who has decision making power
Nigeria.
for to support you to move through the ranks. Someone who's in that room when they're having a promotion conversation and is part of the deciding body and can say, let's consider Dr. Banda here.
Yeah.
Let's consider, and it carries weight. That is important. Mentorship is important, meaning the person who's in the background guiding you, take this action, take that action. Have you considered this and that? That's important. But I find that in terms of moving up the ranks, and really advancing in careers, sponsorship in that sense is important. It's a good call out on the
Very
different
true.
different kinds of sponsorship.
I mean, you've highlighted some important elements of leadership, especially for women in global health. And I know most people would see your title, health economist, and immediately all they think about is spreadsheets. And especially coming from the clinical background. Um, what does your day to day actually look like? So, for example, when you were working with the World Bank, what was your
Right.
typical day like as a physician who moved to be a health economist?
Oh, it's a wrong question. Spreadsheets. That's really funny. So in many ways, my job description in the World Bank as a health economist I was a problem solving partner to my clients, who at that time was whoever was the minister of health in the country, right? So my job really was to sit with them, to sit with their teams, brainstorming over what are the key problems. In some cases, we design studies to help us figure this out. One of the ones we did was a nationwide study in Armenia, looking at every single primary healthcare clinic. What equipment do they have? What medicines? What kinds of health workers? How do they perform in terms of clinical interactions? So it's to try and unpack the problem. It was pulling people together. That's one of my favorite things about the World Bank, is that We had significant convening power, and so we could pull together other multilateral partners, government partners, the private sector, associations, non-profits, civil society, to then ruminate over the ways in which we are distilling the problems. Are these the right problems to solve for? Are there things you see that we might be missing? How do you think we should approach the solution? Yes, these are the global frameworks for, improving health financing or service delivery or health information systems. But what do we know that works in contexts like this? We tap into local knowledge, and then we're structuring, because the World Bank in the end, we package things in projects, right? So then we're structuring. So what does it look like over a 5-year timeline to make a dent on this problem with this menu of solutions, and to put resources behind it, money, people, institutions. So that was my job. It was a lot of fun partnering, pulling resources together, meeting. And sometimes I was hunkered down and doing analysis. I wrote some really useful papers, macroeconomic modeling, for example,
Mm-hmm.
papers, for example, yes. But a lot of it was being a problem solving partner. Now, in Visa, once again, relationships. My job is to be a strategist, is to help think about how do we make sure that the way we define social impact is the most compelling way, given what Visa does as a company. And as a leadership, we can convene around this is what social impact means. And then how do you translate that definition to every single project across,
Mm-hmm.
the group? So
Yeah.
that whatever person A, person B, person C, person D is doing in different countries around the world ladders up to this overall vision we're trying to drive of improving financial well-being for small and micro businesses, for women, for individuals, for men, right? So it's things like that. And then where does the data come from? So data comes, and yes, sometimes I have to look at spreadsheets when the data comes in, but I have data scientists that I work with that will do the work of sort of analyzing it, but making sure that that story is coherent, it translates to the programming, the data comes, and then we talk about it. We talk about it in ways that tell people about like the work that we do, and how it sort of shifts things and feeds back into our strategy of like, okay, now, given what we've learned from the data we've collected, how can we do better? So yes, there's some spreadsheets, but for sure, my job, it feels like I'm still problem solver is my principal role, and relationship builder, I would say.
Okay. Okay. I
Yeah.
think that's interesting to know. And now that you are at Visa, what are say some of the most exciting projects, or what are some of the projects that you've worked on or you're currently working on?
So I would say, so like I said, the thing we are trying to push towards is improving financial well-being for people and for businesses across the world, right? And so we see as central to that mission, being able to transact in the digital economy is critical, right? Think about the person who has a store on the side of the road and can only have, customers from within her vicinity. And then now suddenly she has an e-commerce website. She can receive payments from a range of options. Now she has customers from all over the world. Her payments go up, her sales go up, her income goes up, her household is able to afford a better life. That's the sort of transformation that we want to do. Now, because of how complex the factors can be that are shaping this whole question, I find that the most interesting programs I'm working on with partners, they have like an ecosystem approach. It's like there's a lot of things that are coming together. Does this person need skills? Does she need the first device? Does she need access to markets? Does she need access to coaches? Does she need access to capital? What does access to capital imply for her? Is it a different way for assessing her risk in terms of borrowing? How do we make sure she can keep like a track record? Does she need financial management systems? So it turns out that the deeper we go into understanding the problem, the more complex the solution becomes in terms of the moving parts, the institutions involved, and how they interact. And so the challenge that I tend to engage with on the one hand is really, first of all, pointing out like this complexity. The can we make sure we're not missing out any moving parts as we're pulling this together through a theory of change, right? It's like, can we map out from the thing we're solving for problems all the way to impact how business is excelling? How do we get from here to there? And it exposes to our teams, oh, we forgot about this, we forgot about that. What can we pull in? Who can we pull in? And then it's also then how can we track things? And I try not to
Mm-hmm.
make measurement the obstructor to achieving results, right? Because sometimes there are things that are really essential to this, but you can't measure,
Yeah.
can I measure an increased confidence in this woman? It's key, right? But like increased confidence is not something I can track. So we think about what can we track And where how else can we tell our story? And so I'm a big believer in mixed methods, a tool I picked up, of course, in my PhD of yes, we can track some things, we can do surveys, we can do, other things to collect the data. But in some cases, what we need is a more deep dive, more qualitative kind of information to lay on top of that to then talk about the impact that we have. Right. So the projects that are ecosystem level are the most exciting and the most difficult. And yet I find the ones that have the most compelling value proposition for an institution of our size and our capability and with our ability to pull partners together.
Okay, okay. And I know you've worked across several countries as we initially explored. So for policymakers or implementers, what's one thing they need to understand about, say, how capital moves and how real change actually happens at the global level?
It's a good question. I think the best thing I would say is that capital follows incentives, not necessarily intention, right? So there are things that we really care about. I care about equality of opportunity. This idea that just being born in a place should not mean you don't have access to healthcare and education and financial well-being. But a lot of the capital moves in direction of profit. And I've found as a central question to think about how can we marry these objectives and how do we think about the trade-offs between the two? And be okay with engaging with that question and not saying private sector capital is bad. And so the first skill set I think that someone who cares about these kinds of issues and wants to move capital in that direction needs to contend with is thinking beyond the single bottom line of impact to a double or a triple bottom line. What does it look like to marry profit and purpose and make a compelling case for how, for example, growing the woman-led segments of small businesses, it improves financial well-being, but there's a compelling case in terms of profit and revenue growth, right? Or a triple bottom line. Maybe there is the impact case here, there's a revenue case here, there is a branding and reputation case here. And I think being able to work through those problems and communicate them effectively is one way to sort of direct capital to the things you care about. I think the second thing that we need to be okay with is that sometimes the problems you want to solve are not problems that are immediately attractive to the private sector, right? So something that is not an oft known factor is that a lot of the big innovations on which our society's advancements have been built have been invested by the US government. The
Yeah.
internet, for example, advancement in machine learning, in space travel. So sometimes when an venture is very risky, it involves, in economics, you talk about public goods, it's very hard to privatize it. We need the government to step in and take a principal role and take on the difficult bets and risky bets and moonshots and create an environment that leads to the private sector and Elon Musk and Jeff Bezos to step in later. And I think we need to sort of think carefully about when do we need a private sector? What role do we need the private sector to play? Versus when do we need the public sector to step in to de-risk, to build infrastructure, and things like that that make the environment sort of conducive for the private sector to come in, right? So I think those are basic. My 2 points to the altruistic person is one, it's okay for the end point to not just be impact, and
Yeah.
secondly, sometimes it's not the right time for the private sector to engage. I want to think about a long-term plan that involves different roles for the public and private sector, where the public sector de-risks an engagement for private capital.
That is very, very true, and I think that is one of the issues that we are having currently on the continent. I've engaged with a lot of leaders from the pharmaceutical company side, and they always bring up the idea of the risk involved for them to go
Right,
full scale,
right,
to go set up manufacturing facilities when the governments themselves are not showing interest in
right,
investing in health. So I think
right.
that is pretty much very important. All right. So thank you so much for sharing such an amazing journey and the projects that you've been working on. I also most times like to pivot to something more personal, more light for our audience. So if you could go back in time and speak to your 26-year-old self, maybe fresh in medical school or fresh in graduate school with big dreams, what would you say?
Well, I think I'll tell myself to lean into the discomforts. My path hasn't been very linear, right? So lots of pivots, medicine to health policy to social impact, and all of those have come with steep learning curves, and yet they've led to, I think, really exciting and adventurous times, right, in my career. And so I would ask my younger self to be comfortable with, not having a lot of certainty, and always being sort of pushed into discomfort in terms of learning. Um, the second thing is that I would remind myself to be authentic. In many of the spaces that I'm in, not a lot of people look like me or act like me, but I think that that's what makes my contribution unique. Is the experiences that I bring and the lens that comes with the fact that I've worked across multiple sectors. I have lived many of the experiences of the people that we want to serve in person. And so it means I can come to these conversations with a unique contribution. And so my difference is in many ways my advantage. And then I think the last thing I would remind myself at a time in 26, I'm sure I'm steeped in, the importance of technical knowledge, is I would remind myself to build bridges. That relationships are critical. It's how you drive change. It's how you build
Hmm.
coalitions that, make, social impact happen. It's how you find allies that defend you and speak for you, and sponsors and mentors, and people you can build to and pay forward with. And so that relationships at the heart of social impact, even though it will not be obvious to my 26-year-old self, but that's what I would.
Okay, that's certainly true. But what keeps you intellectually alive apart from looking at spreadsheets and advising governments?
These spreadsheets I don't look at. Well, right now I'm reading a book I really like. It's called Values by Mark Carney, who's Prime Minister of Canada and has the distinction of being, I think, the only person alive who's been central bank governor in two different countries. In that book, he contends with the question of how do we direct capital to things that are of value, even when price is an imperfect sort of marker of value, right? So things like, climate change, things like healthcare, education, housing. How do we solve those tricky problems and make it an attractive space for everybody to engage in? So, I love reading that book. I love podcasts. I also love working out. I tend to work out in groups, things like Zumba, high intensity interval training, tennis, swimming. So I'm very big on team sports and interacting with other people versus, going solo. So, those two things. And then also with my friends, we tend to travel quite a bit. We were in Mexico a couple of years ago, Italy last year. This year, we're going to three countries: Tanzania, Kenya, country of my birth, and Rwanda,
Hmm.
spending 2 whole weeks. So, I'm really excited about that.
Awesome. So, if, for example, I know you've already shared that you always wanted like to be a surgeon. If let's say you were not in global health, would you say by now you would be like, say, a consultant, uh,
Well, if I
trauma
stayed in
surgeon or
medicine,
neurosurgeon?
if I studied medicine, I probably would have gone on to become a consultant and a professor. But I think knowing what I know now, the alternative careers for me would probably be starting a social enterprise or mentoring other students in global health. The former because I really care about social problems, and I
Hmm.
think it's such an adventure to hunker down and build a business from the scratch that is actually also driving social impact and addresses the double bottom line I talked about before. Can we
Yeah.
make profit and pursue purpose? And in terms of mentorship, I really enjoyed as a PhD student mentoring other students. One of my highlights was I was the teaching fellow for Amartya Sen in a course on poverty and development. And some of those students who I spent lots of time with, have gone on to become assistant professors. And I just love engaging with people and thinking through the tricky questions and helping shape, how they contend with those questions. So, I think professor, business owner, I know polar opposites, but I think those are options that I would have explored.
Okay. Um. Uh. I know initially you were saying that you said you grew up in Ghana or you are from Ghana. I didn't
I am
quite get
Nigerian. I grew up, I spent some time in Kenya. That's it. Yeah.
Okay. Anyway, since you're
Yeah.
the way you're defending Niger, I have to skip this question because I may not like the answer.
Yes,
Um,
please.
But before we go, I know there are a lot of professionals watching this platform. Some are thinking of transitioning from clinical practice to global health. Others are also thinking about pivoting from one industry to the other. What advice would you give those early career professionals?
Yeah, it's I've had many conversations with people, over the past few weeks, given the climate about this. And I tell them these things because they helped me. Was one to really think through my why, right? It's the standard against which I hold whatever thing I'm engaged in is what problems do I want to solve, what kind of environment do I want to work in, what values of mine do I hope are represented by my role, right? And I think it's important to sort of have, so you're not necessarily just running away from something, whether it's unemployment or a bad job, but you're running to the kind of role that will bring you some fulfillment. The second thing I have learned is to atomize my skills. It's something my coach taught me, is to go from thinking about myself as just a health economist to really breaking down what kinds of problems I solve from the day to day, right? I work with data really well. I'm able to communicate complex facts, up the chain, to senior leaders. I'm really good at leading complex negotiations, at building coalitions and building strong, well-performing teams. I really have strong data acumen, things like that, right? So it's to think about, when you abstract away from I'm a health economist, I'm a gender expert, I'm a health financing person, what things can you actually solve for, and where are those skills needed? Because they might be needed outside your traditional sector. And atomizing them in that way allows you to see those opportunities beyond the traditional sort of groupings you might have put yourself in. And the third thing is, I found the value of fellowships. Global Health Corps, which is a fellowship I did in my just after my master's degree, was the way many of my friends pivoted. They came in as architects, they came in as supply chain experts, and they left, having been placed in organizations like Clinton Health Access Initiative, or Partners for Health. So I've done a couple of fellowships in over the course of my career with Aspen, Women Lift Health, and I found all of them to be useful ways for helping with the pivot, to plugging into networks, connecting you with other people who can brainstorm, right? So finding a fellowship in the field you're interested in and making the case to join can be sort of a vehicle to sort of, get you to make that shift as well.
Awesome, awesome. Thank you so much for sharing that treasure of an advice. And thank you also for taking the time and joining us for this wonderful conversation. I can see that I truly enjoyed listening to your conversation, and the most impactful things that you've done. And I'm hoping that our listeners would also enjoy this. So thank you so much for joining us.
Thank you very much, Dr. Banda. All of this.
Thank you.